A new investigation into our state psychiatric hospital.
Are people supposed to die here?
Of course not.
A homicide, suicides, and escapes, things that never should happen inside these walls, but they all happened in recent years. And inspectors have not cited nor punished the Arizona State Hospital for any of those major failures. How is that even possible?
Tonight, ABC 15 Chief Investigator Dave Biscobine is about to show you how the state has been allowed to investigate itself and clear itself of any wrongdoing.
First, we want to give you plenty of warning. What we're about to show you is violent and graphic, but we're showing it because it shows both the flaws in the system and why lawmakers are finally working to change things. The Arizona State Hospital is located in the heart of Phoenix, but very few people know what actually happens inside its walls. Like the homicide on April 23, 2019.
Bam! Hit him on an uppercut.
A patient repeatedly pummeled another.
That started and I finished him.
No staff in sight until it was too late. The victim died hours later. My first instinct is I'm going to go check online for the inspection reports. He's got to be in there, right? People aren't supposed to die at the mental hospital, and nothing's ever there. Why does this stuff never show up in the deficiency list?
I think there are a couple of reasons. The reason is that nobody holds Ash accountable.
This is Holly Giesel and Josh Mazel. Now, Ash only has about 300 patients, but collectively, these two attorneys have represented roughly 50 of them in the last 5 years.
There's stories after stories after stories that we could tell that cannot be aired on regular TV. They are so horrific.
You know, I mean, here's something. I mean, I don't even know how much of this I can even show on TV. It's so gruesome, right? But I mean, we have a patient on October 20th, 2021. He's given us scissors, sharp scissors. He takes it in here, and I mean, this is, you guys can see for yourself. I mean, we obtained photos and incident reports from a patient's suicide on October 20th, 2021. We made black and white copies because the original color photos are just too graphic. In short, a patient was given scissors, then led into a bathroom. If anything, how is this not something that shows up on an inspection report? A patient in a psychiatric facility gets his scissors and he kills himself. And that's the scene.
I think this is exactly what we're getting at, is that these things continue to happen, and we have the fox guarding the hen house. By the fox guarding the hen house, this is what he means. Arizona Department of Health Services inspectors are supposed to investigate medical facilities. The problem? The state health department also runs the state hospital, meaning we have to trust the state to investigate its own failures.
That's absolutely correct. And it's something that the former director of health services in Arizona has pointed out as a fundamental flaw.
That former director of the state health department is Will Humble.
But it's the easiest thing in the world for somebody in that position to decide to go easy because they don't want things to look bad. They don't want a bad inspection report.
This is Humble testifying at the state capitol a few weeks ago. He's pushing to get a new law passed. It's Senate Bill 1710. It would put the state hospital under the control of a new governing board and take it out of the state health department.
You don't have to be a rocket scientist to know that you shouldn't be regulating the same place that you're running.
We've been investigating the state hospital for a decade. Mr. Humble, you got a second? And under Humble's directorship, the state health department did previously give its hospital a failed inspection after our investigations in 2013 and 2014. Something that has not happened since.
Cover-up is a strong word, but it's a cover-up.
The state hospital has been on fire for 10 years. And in the last few years, it's intensifying. It's getting worse. It's becoming more dangerous.
In 2013, we exposed there was a large number of escapes from the hospital. One patient ended up killing a woman, and it's still a problem. We just got leaked records from an escape in August 2021, but check the inspection reports, nothing. And these attorneys say there's so much more we haven't seen.
Since 2021, there have been more suicides, more deaths, and more attempted escapes.
There's reviews and no deficiencies found. Mm-hmm. You know, that's the thing that needs to change. We need some accountability, and we have proven for more than a decade now that it's not coming from the executive branch. It's not coming from the Department of Health Services.
In a written statement, the health department told us they cannot comment on the proposed law change and would not talk about specific cases about patients due to health privacy laws. But they did say There appears to be an inaccurate assumption that every event should automatically result in a citation or a noted deficiency for a healthcare institution. The statement also said the hospital is seen as an innovative leader among its peers. Now, we've done dozens of reports about the repeated problems at the state hospital. We've put links to many of those up on our latest story, which you can find at the top of abc15.com/investigators. I'm investigator Dave Biskobing, ABC 15, Arizona.